Waking up after a medical procedure can feel a little disorienting, especially when it involves your lungs. So, what exactly happens in those first moments and hours after a bronchoscopy, and what should you be aware of to ensure a smooth recovery? Immediately after a bronchoscopy, you can expect to be moved to a recovery area where medical staff will monitor your vital signs very closely. Your throat will likely feel numb for several hours due to the local anesthetic used during the procedure, and you will not be allowed to eat or drink until this numbness has completely worn off. This is a crucial safety measure to prevent food or liquids from going into your windpipe, which is sometimes called aspiration. The primary reason for these initial sensations and restrictions is the direct impact of the bronchoscope itself and the medications administered. The scope passes through your vocal cords and airways, which can cause temporary irritation and swelling. Additionally, the sedatives or general anesthesia need time to wear off, leading to drowsiness and a temporary decrease in your gag reflex. Monitoring ensures that your breathing and circulation are stable as your body recovers from the medication and the procedure. To manage the immediate aftermath, you will be asked to rest quietly while the anesthesia dissipates. Once your gag reflex returns, which a nurse will check gently, you can usually start with small sips of water. If that goes well, you may gradually progress to soft foods like crackers or soup. It is also common to have a mild sore throat, cough, or hoarseness for a day or two, and lozenges or warm tea can often provide some comfort. An important insight is that some patients might experience a slight fever or mild discomfort in their chest, which is often a normal reaction to the procedure and usually resolves quickly. However, any persistent chest pain, difficulty breathing, or significant fever should always be reported to your medical team immediately, as these could signal a less common complication, though they are quite rare. Your doctors are looking for any signs of pneumothorax, which is a collapsed lung or a serious infection, which is why close monitoring is so important. Understanding these immediate, post-procedure expectations empowers you to feel more in control and less anxious about your recovery. By following your medical team's instructions for resting, waiting for your gag reflex to return, and knowing when to report unusual symptoms, you are actively contributing to your own safe and comfortable healing process, paving the way for a quicker return to your daily activities.